Hey everyone, today, we're diving into the human skeleton. We've already covered the structure of bones, so now let's see how they are assembled in the body. The skeletal system mainly consists of bones, around 206 in an adult. But there is also a significant amount of cartilage, joints, and ligaments, which together make up about 20% of a person's body mass. We'll get to joints a bit later, but first, let's explore the different bones in the body. The human skeleton is divided into two sections, the axial skeleton, which includes the skull, vertebral column, and thoracic cage, and the appendicular skeleton, which is mainly the limbs. Let's start with the axial skeleton, beginning at the top with the skull. The skull is a fascinating structure made up of 22 different bones. Cranial bones protect the brain, while facial bones give structure to the face. Most skull bones are flat bones, and in the cranium, they are connected by serrated lines called sutures. The cranium is made up of a vault and a base, divided into the anterior, middle, and posterior cranial fossae. Together, these form the cranial cavity where the brain sits. There are also ear cavities, nasal cavities, and orbits that house the eyes. Altogether, there are 8 cranial bones: the frontal bone, 2 large parietal bones, the occipital bone, 2 temporal bones, the sphenoid bone, and the ethmoid bone. The cranial bones are connected by sutures, which have specific names: coronal, sagittal, lambdoid, squamous, and occipitomastoid sutures. We should also mention the foramina, which are holes that nerves, arteries, and veins pass through, most notably the foramen magnum at the base of the skull, through which the spinal cord passes. Moving on to the 14 facial bones, we start with the mandible, the lower jawbone, and the maxillary bones, which form the upper jaw and part of the face. Next, we have 2 zygomatic bones, the cheekbones, nasal bones, which make up the bridge of the nose, lacrimal bones, palatine bones, the vomer, and inferior nasal conchae. There's also the hyoid bone, which sits just below the mandible and does not connect with any other bone. Next in the axial skeleton is the vertebral column, also called the spinal column or simply the spine. It's made up of 26 irregular bones that form a flexible, curvy structure supporting everything from the skull to the pelvis. The spine is divided into 5 sections. At the top are the cervical vertebrae, the first 7. The next 12 are the thoracic vertebrae. The remaining 5 are the lumbar vertebrae. Vertebrae get larger as we move down the spine to support more weight. Below the vertebrae is the sacrum, which is actually 5 fused vertebrae. Lastly, below the sacrum is the coccyx, or tailbone, made of a few tiny fused vertebrae. The spine is more than just vertebrae. It has many ligaments keeping everything together. The main ones are the anterior and posterior longitudinal ligaments, running down the front and back of the column from the neck to the sacrum. There are also shorter ligaments connecting adjacent vertebrae, and intervertebral discs, which are cushiony pads made of a nucleus pulposus surrounded by an annulus fibrosus with lots of collagen. These discs are found between each vertebra, acting as shock absorbers when we run and jump. Let's look closer at an individual vertebra. Each vertebra has a body and a vertebral arch. The hole in the middle is called the vertebral foramen, through which the spinal cord passes. The vertebral arch is made of 2 pedicles and 2 laminae, from which various processes project. These processes include the spinous process, 2 transverse processes, and the superior and inferior articular processes. Vertebrae vary slightly depending on their location in the column. Cervical vertebrae have a short spinous process, a large vertebral foramen, and an additional transverse foramen for vertebral arteries. Thoracic vertebrae have a long, downward-pointing spinous process and demifacets that connect to the ribs. Lumbar vertebrae are larger with short, thick pedicles and laminae, among other slight differences. The last part of the axial skeleton is the thoracic cage, which includes the sternum, ribs, and a lot of costal cartilage. The sternum is a flat bone in the middle of the thorax, made of 3 fused bones, the manubrium, the body, and the xiphoid process. There are 12 pairs of ribs projecting from the vertebrae. The first 7 pairs attach directly to the sternum via sections of costal cartilage and are called true ribs. The next 5 pairs are false ribs, 3 attach indirectly to the sternum with costal cartilage joining the cartilage from ribs above, and the last 2 are floating ribs, as they don't attach to the sternum at all. Ribs are flat bones that get longer from pair 1 to pair 7, then shorter again from 8 to 12. With the axial skeleton complete, let's move on to the appendicular skeleton. While it's mainly our limbs, there are other components too. Starting with the pectoral girdle, it comprises the clavicle, collarbone, and the scapula, shoulder blade, which together give structure to the shoulder and attach the upper limbs to the axial skeleton. The clavicle has a sternal end where it attaches to the manubrium and an acromial end that joins the scapula. The scapula is a thin, flat, triangular bone with three borders: superior, medial, vertebral, and lateral, axillary. Now, onto the upper limb. This consists of the arm, forearm, and hand. Though we commonly refer to the whole thing as an arm, anatomically, the arm is just the upper portion. In the arm, we find the humerus, a typical long bone with features like the greater and lesser tubercles, radial groove, medial and lateral epicondyles, radial and coronoid fossae, trochlea, and capitulum. Moving on to the forearm, there are two bones, the radius and the ulna, connected by the interosseous membrane, a flexible ligament. The ulna is slightly longer with its olecranon and coronoid process. The radius goes from wide to thin, with a thin head, radial tuberosity, and radial styloid process. In the hand, we have many bones. The carpus, wrist, is made of 8 short bones called carpals, scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Next are the 5 metacarpals, making up the palm of the hand, numbered 1 through 5 from thumb to pinky. These connect to the phalanges, which are the bones of the fingers. There are 14 phalanges per hand, 3 per finger, distal, middle, and proximal phalanges, except the thumb, which has 2, no middle phalanx. Moving back to the torso, we see the pelvic girdle. This attaches the lower limbs to the axial skeleton, providing far less mobility but much more stability than the pectoral girdle. The pelvic girdle starts at the sacrum and continues with 2 hip bones. These hip bones are made of 3 separate bones at birth, which fuse into one by adulthood, but we still describe the regions as the ilium, ischium, and pubis. Lastly, the lower limb contains very thick bones, enabling us to run and jump effectively. The thigh is made of a single bone, the femur, the largest bone in the body. Here we see the head with a small pit called the fovea capitis, the greater and lesser trochanter, intertrochanteric crest, gluteal tuberosity, linea aspera, medial and lateral condyles and epicondyles, intercondylar fossa, and patella. In the leg, like the forearm, there are 2 bones, the tibia and the fibula, with an interosseous membrane between them. The larger tibia has the medial and lateral condyles, intercondylar eminence, tibial tuberosity, anterior border, medial malleolus, and fibular notch. The fibula is much thinner with its head and lateral malleolus. The foot is similar to the hand. It has the tarsus, made of 7 tarsal bones, the talus and calcaneus, the ankle, cuboid, navicular, and medial, intermediate, and lateral cuneiform bones. Then there are 5 long metatarsals, numbered 1 through 5. Like the hand, the foot has 14 phalanges, 3 per toe, except 2 for the big toe, hallux. So, that wraps up our basic tour of the human skeleton, at least from the standpoint of the bones, which are the primary component. But there are other structures critical to the function and mobility of the skeleton. These are called joints. Thanks for watching, guys. Subscribe to my channel for more.